Dr. Aditi Bhagat specializes in general cardiology and is board certified in echocardiography, nuclear cardiology, vascular ultrasound, and general cardiovascular disease. She does have a special interest in the management of chest pain, coronary artery disease, women's heart health issues, and hypertension. While pursuing her Master of Public Health and Epidemiology, Dr. Bhagat was initially drawn to cardiology and heart disease prevention due to its significant impact on public health. Dr. Bhagat is a graduate of George Washington University School of Medicine. She completed a residency in internal medicine at Stony Brook University, where she also did her cardiology fellowship. Dr. Bhagat sees patients at Virginia Heart's Arlington office and also provides care at Inova Alexandria, Inova Fair Oaks, Inova Fairfax, and Inova Loudoun hospitals. With that introduction, I'm going to turn the floor over to you, and I'm going to go away until the end. And I wanted you to bring your slides up, and we're looking forward to hearing your presentation. Thank you.
Thank you, Warren, so much for that introduction. I am going to share my slides right now.
There you go.
Perfect, thank you.
Full screen. Yep.
Perfect. Hi, everyone. My name is Aditi Bhagat. I'm one of the cardiologists at Virginia Heart, also in partnership with Inova. And today I'm going to be talking about American Heart Association Life's Essential 8. We're going to be healthy for good. So Life's Essential 8 are the key measures for improving and maintaining cardiovascular health as defined by the American Heart Association. The better cardiovascular health basically helps to lower the risk for heart disease, strokes, and other major health problems. So this is an overview of everything we're going to be talking about today. The first thing is we're going to be talking about eating better, being active, quitting smoking, better sleep, weight management, as well as cholesterol, sugar, and blood pressure management. So the goal here is going to be we're going to be talking about, again, how to eat better. So AHA recommends indulging in the following foods: vegetables, fruits, whole grains, beans and legumes, nuts, plant-based proteins, lean animal protein, skinless poultry, as well as fish and seafood. They recommend limiting the following things: sweetened drinks, alcohol, sodium, red and processed meats, refined carbohydrates, full fat dairy products, and highly processed foods. And as you can see on the right, there's a picture basically outlining the spectrum of the processed foods. On the left side, you can see that corn and apples, for examples, are unprocessed foods. And as you go towards the right, you see that cereals and maple syrup and chips and foods along those lines are the more processed / ultra processed foods. Also recommend limiting coconut and palm oil, and they also recommend avoiding altogether trans fat as well as hydrogenated oils. These include, again, as you can see in the picture at the bottom, they include baked goods like crackers, biscuits, pies, fried foods like fries and hamburgers, as well as chips, margarine, vegetable shortening. And a lot of street food as well as restaurant food, as you can imagine, has a lot of trans fat. So one of the things that I think a lot of people struggle with, including myself for a long time, was how to interpret a nutrition label. So when you're looking at the label, it makes it easier to make a healthier food option. And when you have more than one choice, I would recommend comparing the two nutrition labels. First thing is to look at the serving size and look at the calories in each serving. Remember to take into account how many servings you're going to be eating. Also look at the fat, not just the total fat, but also the trans and saturated fats. This is actually more important than the total fat is. Look at the total amount of sugars. The sugars will always include both the added as well as the natural sugar. Look at the amount of fiber. In general, we recommend about 25 to 35 grams of fiber per day. Fiber will help to reduce cholesterol. It helps you to feel full. It helps you to manage weight. and also look for foods lower in sodium as well. The percent daily value of the vitamins, as you can see noted at the bottom, number 4, this is based upon a 2,000 calorie diet, but it depends upon your age, your gender, your body type, your activity level. So this can vary per person, sorry. And we also recommend eating only as many calories as you use during the day, including your physical activity. So I recommend cooking at home, and also the American Heart Association actually has a lot of recipes online that you can choose from. A lot of foods as well also have the heart check, as you can see on the left side of the screen. This helps you find food that can be part of a healthy eating plan. This actually certifies products under 10 different health claims in 13 categories. It takes a look at the amount of sugars, usually it looks at cholesterol, sodium, etc. So all of these things are very valuable. So being active. Adults should get a weekly total of about 150 minutes of moderate activity per day, or sorry, per week, or 75 minutes of vigorous aerobic activity per week, or a combination of both. Kids and teens usually need about 60 minutes of physical activity per day, including play as well as structured activities. Moderate activity includes some of the things listed over here, such as water aerobics, dancing, such as ballroom dancing or social dancing, pickleball, brisk walking, and I would recommend about 2.5 miles per hour or so at least, gardening, doubles tennis, and biking slower than 10 miles per hour. Aerobic activity, that's vigorous activity, includes singles tennis, includes running, taekwondo, swimming laps, jumping rope, walking more than 4.5 miles an hour, biking more than 10.5 miles per hour, mountain climbing, and certain sports like competitive basketball as well as soccer. In addition to aerobic exercise, the AHA actually also recommends muscle strengthening activity like resistance or weight training at least 2 times a week. Uh, in order to continue strength training, you can add intensity, such as increasing the time, the distance, or the amount of effort for more benefit. They also recommend, as we kind of spoke about before, about getting up and continuing to move throughout the day. So tips for moving more. In general, first things first is to set goals. Set realistic goals and make them small, lasting changes to help set yourself up for success. Once you reach these goals, don't stop, keep on going. Gradually increase your activity and intensity to gain even more health benefit. There are many ways you can get active. You might find walking is the easiest way to start this. Not only can it help you feel, think, and sleep and live better, but staying active improves your overall quality of life. I would also recommend finding ways to continue to move throughout your day, whether it's at work, on your commute to or from home. Every minute does count towards your overall goal. And lastly, I would recommend doing something active every single day at the same time so it becomes a regular habit. Put it on your schedule so you're less likely to miss a day, less likely to think about it. It just becomes part of your normal routine. Quitting smoking. So the first step to quit smoking, vaping, and using tobacco products is to understand the health risks for you and your family. Tobacco use and nicotine is a growing crisis among teens as well as young adults. Tobacco products contain many toxic chemicals, as well as their smoke, the vapor, and the liquids, and it's the most preventable cause of death in the United States. Smoking damages the circulatory system and increases your risks of multiple diseases. It's linked to about a third of all deaths from heart disease. And actually, within a year of quitting smoking, you can actually reduce your risk of heart disease by almost 50%. Smoking is linked to 90% of lung cancers, and it's also linked to a variety of other cancers, as you can see on the screen over here. It's linked to lung diseases such as COPD, type 2 diabetes. It can lead to harmful reproductive effects, and it can also be linked to other diseases like eye diseases and immune system problems like rheumatoid arthritis. Secondhand smoking contributes to over 40,000 deaths among non-smoking individuals and 400 deaths in infants every single year. In adults, it can lead to heart disease, stroke, and lung cancer. And in children, it can lead to respiratory infections, asthma, and as well as sudden infant death syndrome. You're more likely to quit smoking tobacco for good if you come up with a plan that's going to fit your lifestyle. So these are the things I would recommend to go about it. Set a quit date within the next 7 days. Choose a method. Choose if you want to go cold turkey or if you'd like to do it gradually. And decide if you need help from a healthcare provider. There are also other options in terms of using nicotine replacement patches or even medications. Prepare for your quit day. Plan how you're going to deal with urges and cravings, which we're going to talk about in a second, and also quit on your quit day. So, dealing with urges, whether it's physical or mental, learn your triggers and make a plan to address them. Avoid situations that are going to make you want to smoke or use tobacco until you're confident that you can handle those situations. Getting active. Physical activity can help you manage the stress and cravings when you are quitting. And learn other healthy ways to manage the stress of quitting as well. A buddy system or a support system can help support you. Also, 1-800-QUIT-NOW is a great line. It's a free line and it does work. And stick with it. Cutting tobacco takes a lot of willpower. It's very difficult, and I would recommend rewarding yourself when you reach milestones and forgive yourself if you have a step backward. You can just get back on course as soon as possible to get to your goal. Getting healthy sleep. So getting a good night's sleep every night is vital to cardiovascular health, and I know it's quite difficult for a lot of us, but as I'm going to go through here, it has a lot of benefit. Adults have to get about 7 to 9 hours of sleep every night, and babies and kids need even more sleep than that. Too little or too much sleep is associated with heart disease. You know that jittery feeling that you get when you haven't had enough sleep? Usually, deprivation can affect inflammation in your body, and it can activate the fight or flight response and activate those hormones associated with it, like cortisol and adrenaline. And this leads to high blood pressure, type 2 diabetes, obesity, high cholesterol levels. It can also lead to cognitive decline as well as the risk of developing mental issues such as depression as well as anxiety. Benefits of sleeping. They are long and varied. The healing and repair of the cells and tissues of the healing and repair of cells, including the tissues and the blood vessels, is important. It helps consolidate memories and clears plaque-forming amyloids that can potentially contribute to Alzheimer's disease. Leads to a better immune system. It leads to improved mood and energy, and in general, sleep disruptions can affect your levels of neurotransmitters and stress hormones, and it makes you more difficult to think and regulate your emotions throughout the day. It's very instrumental in cognitive function. It improves mental acuity and the ability to concentrate and learn new things. During sleep, your brain learns how to deal with information it receives throughout the day, and then it consolidates it. And again, it increases your alertness, your ability to problem solve, to focus, and to reason. There's also a decreased risk of chronic diseases. Sleeping better. So in terms of sleep hygiene, there are a couple things I can recommend. Try to go to sleep and wake up at about the same time every single day. Don't change your sleep pattern too drastically between the weekdays and the weekends. Binge sleeping really does not work. Sleeping in over the weekend to counteract the effects of not getting enough sleep throughout the week is known as which is known as sleep debt. That again does not work. Increasing your amount of physical activity and making it a morning routine will help your sleep. Exercising in the morning can help kind of quote unquote jumpstart your day. And it also, the exposure to the light in the morning is good for your circadian rhythm, which is the internal process that controls your sleep and waking cycle. Eating a healthy diet, eating, as we spoke about earlier, helps to improve your sleep as well. More saturated fats and sugars have been shown to cause less deep sleep, and eating more fiber has actually been shown to improve it. Balance your calories throughout the day. When you get more calories late at night, sleep might also be less peaceful. Heavy meals can trigger reflux disease, and you may need to make some dietary changes as we grow older. You might be affected more by caffeine as you grow older, but more by stimulant use in the afternoons, for example. You might want to avoid alcohol too close to bedtime, This does lead to you falling asleep earlier, but it leads to significantly broken sleep as well as overall poor quality of sleep. If stress is taking a toll on your sleep, I would recommend finding practices that help you relax. These could include meditation, deep breathing, writing. Some people make lists and put things on the calendar if they're getting stressed out. This can be actually pretty calming for some people. Recommends going low tech, not using cell phones in the evenings, which I'm going to go through a little bit further. And I would recommend, again, keep trying. Some of these lifestyle changes are based on your personal preference, and it might take some trial and error to figure out what works best for you. In terms of your phone, I feel like lighting and television and phones have been something that is very important in terms of addressing, especially in this day and age. So some tips include number one, moving your phone. Charge your device as far away from your bed as possible. And the nice added bonus is that distance can make you feel less overwhelmed by your phone in general. Dim the light on your phone. Use a red filter app at night if you can. The bright blue light of most devices, including TVs and phones, can mess with your circadian rhythm as well as your melatonin production. Set it. So set an alarm. Alarms are not just for the nighttime, but they're also for the morning time. Or sorry, not just for the morning time, but for the nighttime. I'd recommend setting a bedtime alarm as well to tell you when to remind you that it's ready to wrap up for the rest of the night. Lock your phone. If you have a scrolling habit that you need to kick, I'd recommend getting an app blocking application that makes it better to get locked out of your phone and you can't check emails, social media, gaming, Instagram, etc. And then blocking it. So there are different modes that you can use on your phone, such as sleep mode. You can mute notifications if they're waking you up at night, and you can put your phone also on do not disturb. There are other ways you can also alter these modes to allow certain phone calls to come through if that is one thing that you are concerned about. A lot of the phones do make it easy these days to kind of customize it. Weight management. So understanding how many calories you take in and your activity level can help identify changes that you might want to make. And to lose weight, ultimately, what it comes down to is burning more calories than you eat. So reduction in calories in. I would recommend a couple things. Keep track of how much you're eating. It will let you know if you're eating out of habit, out of stress, out of boredom, or if you're truly hungry. Emotions can be huge triggers for this, so it makes you become mindful about it. Don't eat for a short period of time after you are emotional. Go for a walk or do some yoga, and then when you come back, see if you're still hungry. Healthy snacking at night is okay, like fruit and popcorn, but it's a problem if you're eating a large amount of food at night, especially because the tendency is for that food to be high in saturated fats, such as sugars and ice cream and cookies. So try to eat more during the daylight hours and limit your nighttime eating to just a small snack. And I'd also recommend using a food diary to track where you're eating. You can track how much you're eating and when you're eating, and this also helps you understand your own dietary patterns. In terms of your calories out, an activity tracker can help you track how much physical activity you do on a regular basis. BMI is a numerical value of your weight in relation to your height. It can help you determine if you're in a healthy weight or you need to lose weight. And the ideal BMI is 18.5 to 25. Set realistic goals and know where you are today and know where you want to be. Set yourself up for success with short-term goals, such as I'm going to make lifestyle changes that get me to lose 3 to 5% of my body weight. Short-term goals are often more achievable and they help you keep on track towards your long-term goals. So some tips. First off, I'd recommend portion control. Learn about portion sizes in particular and how much you might really be eating. We have a tendency to underestimate how much we are eating. Get active, sit less and move more, add intensity to your workouts, and this will improve your overall health as well. Eat smarter. As we've already talked about extensively, I'd recommend a diet of vegetables, fruits, whole grains, beans, legumes, plant-based proteins. And if you're not able to lose weight successfully on your own, talk with your healthcare professional. There are also new medications out there that can help you with this. Just a couple more tips in terms of some alternatives that you can use for the other foods that we like to indulge in, but really should not be having too much of. When it comes to desserts and sweets, instead of having a traditional high sugar dessert, you can enjoy the natural sweetness of fruit. Like you can have fresh fruit, frozen fruit, and canned fruits. They're all good choices. I think a common misconception is that frozen fruit is not as good for you, and that's not necessarily true. You just have to take a look at the sodium content of the added sugar content, etc. For dressings and sauces, you can swap out store-bought dressings, ketchup, tomato sauce, which have a lot of added sugars, and you can use homemade versions of this so you can control the amount of sugar you put into them. In terms of snack mixes and granola, you can make your own without the added sugars. You can combine your favorite nuts and seeds that are unsalted or lightly salted, raisins and dried fruits that are unsweetened, rolled oats, and make sure that they're not frosted, and skip the candy instead. You can swap out your sodas and soft drinks for sparkling water with mint, with citrus, cucumber. Sometimes you can add a splash of 100% fruit juice to these to make it taste a little bit better and vary it up a bit. In terms of tea and coffee, I'd recommend cutting back on sugars, including honey and agave. And actually, um, as you gradually cut back, let your taste buds adjust to this a bit and try adding in natural flavors like cinnamon, citrus, mint, or nutmeg are great choices. Cholesterol management. Cholesterol is a fat-like substance that comes from two sources. It comes from your food as well as your body. Cholesterol is made in your liver and it travels in the body by things called lipoproteins. These are called LDL and HDL, which I'll talk to you about in a second. Dietary cholesterol comes from foods, primarily animal products like meats, eggs, cheese, and milk. So HDL it's called high density lipoprotein. This is known as the good cholesterol. And then you have the LDL, the low density lipoprotein, which is known as the bad cholesterol. This is the cholesterol that leads to heart disease and strokes. HDL typically is supposed to keep the LDL from sticking to the artery walls and reduces the plaque buildup, and that can lower the risk of heart disease and stroke. Cholesterol is not bad unless you have too much of it. It's actually quite necessary for a lot of things in the body. It's used to synthesize important steroid hormones like androgen and estrogen. It's used as a precursor for vitamin D, and it also helps maintain the membrane fluidity of various organelles. It's very important to make cells. But when there is too much of it, it can lead to buildup in the arteries of the heart, as you can see from this picture. And it can lead to also buildup in the arteries of the brain. It can trap blood clots and it can ultimately lead to a heart attack as well as stroke. So over here, you can see the way to calculate your total cholesterol is your LDL and HDL and your triglycerides divided by 5. Triglycerides are actually the most common type of fat in the body, and high levels, as you can see, can lead to cholesterol buildup. So heart healthy the total cholesterol should be less than 200, and looking at the LDL in particular should be less than 100. At risk is 200 to 240 for a total, and more importantly, the LDL is 100 to 160 is the at-risk category. And then for dangerous category, the total cholesterol goes above 240 and the LDL is greater than 160. The HDL goals you can see on the right side do vary if you're a female or a male. Usually if you're female or either female or male, the goal is greater than 60. And in the dangerous category, a male who's less than 40 or a female under 50 is dangerous. So tips for success. Eating smart, as we've already talked about. Eating the legumes, eating the nuts, the extra virgin olive oil, the fish. Physical activity helps improve cholesterol levels. And know your fats. The fats that you eat can affect your cholesterol levels. Replace your saturated fats with the unsaturated fats. Replace full dairy with non-fat dairy products to reduce saturated fats. Cut back on pizza, burgers, creamy sauces. Use butter instead of olive oil. Instead of butter, use olive oil. Instead of putting butter or margarine on your bread, use nut or seed spreads that can help you, that can be an alternative source. Use low-fat mayo if you do like mayo, and use oil-based dressings like balsamic vinaigrette rather than creamy dressings. Recommend no smoking, as well as your doctor might prescribe statin medications, or there are many other alternative medications to control your cholesterol levels. Blood sugar management. So the first step to managing your sugar is to understand what makes your blood sugar rise. The carbohydrates and sugars in what you eat and drink turn into glucose in the stomach and in the digestive system. As you can see, if a banana is eaten, it's 17 grams of carbs that's broken down into glucose. And naan bread, for example, is actually 43 grams of carbohydrate, which is broken down into glucose. So as you can see, there's a stark difference in the amount of glucose that's in the bloodstream at that time. So insulin is a hormone to help regulate the amount of glucose in the bloodstream. This is made in the pancreas, and it helps cells take up glucose from the blood, and it leads to lower sugar levels in the blood. As you can see in the top picture, in a healthy person, the pancreas makes the insulin. It goes to the cell, and this allows the glucose to be taken up by the cell. Looking at the bottom picture in type 2 diabetes, glucose builds up in the blood instead of going into the cell, and this is because of a couple of things. Because the body develops insulin resistance, meaning that the body can't use the insulin as well as it should be able to. The pancreas can lose the ability to make insulin, and this can result overall in a high sugar level in the blood. So if you're diagnosed with type 2 diabetes, you need to monitor your blood sugar level regularly. Lower than 100 is normal and in the healthy range, and 100 to 125 is pre-diabetes, at risk of developing diabetes, and over 126 is diagnosed as diabetes. As I'm sure many of you are aware, we also use the A1C levels, which is actually a bit of a more accurate measurement because it measures your sugar levels actually over a period of 3 months rather than just in an acute setting. But as you can see here, you can see the sugar levels that correlate with the A1C levels. An A1C of 6.5 is the diagnosis for type 2 diabetes. Tips for glucose management. Moving more. Being physically active can lower your risk of diabetes and also help you manage diabetes if you already have it. Stay at a healthy weight to help prevent, delay, or manage diabetes. Eating smart, as we've talked about, and stop smoking. Exposure even to secondhand smoke or any type of tobacco products can make pre-diabetes and diabetes much harder to manage. And lastly, blood pressure management. Blood pressure is typically recorded as 2 numbers, as I'm sure many of you are aware of. It's written as a ratio, and this is, as you can see on the left image, it's read as 120 over 80 millimeters of mercury. The top number is the systolic blood pressure. This is the higher of the 2 numbers, and it measures the pressure in the arteries of the heart when the heart is beating. And the diastolic is the bottom number, and this is the lower of the 2 numbers, and it measures the pressure in the arteries when the heart is not beating. This is between beats. Normal blood pressure is less than 120 for the top number and less than 80 for the bottom number. Elevated blood pressure is now 120 to 129 for the top number, and the bottom number is still less than 80. So stage 1 of blood pressure, called hypertension, is your top number is 130 to 139, and your bottom number is 80 to 89. Stage 2 is 140 or higher, over 90 or higher, and then hypertensive crisis is 180 or over 120 of the bottom number. And that is something you should call your doctor for immediately, and if you can't get in contact, I would suggest going to the emergency room. High blood pressure occurs when the force of the blood flowing through your vessels is consistently too high. When blood pressure is high for too long, it damages the walls of the blood vessels, and because of that, there are tiny tears in these blood vessels. So in order to fix these damaged areas, the body sends cells to stick to the site, and over time, cholesterol can go to these sites as well as fats builds up at these sites as well, and it forms plaque. This is the first domino and can lead to consequences including a stroke, which can occur when either the vessels are they burst or they block, heart attacks when the arteries narrow and stiffen, heart failure when the heart is not able to supply blood to the rest of the body, kidney damage, as well as sexual dysfunction. Can lead to erectile dysfunction as well as arousal dysfunction in females. So management tips for blood pressure management. Manage your weight, even if it's a slight amount of weight loss, this can reduce blood pressures. Get active, as we've spoken about. This can definitely reduce blood pressures. Eating smart. Stop smoking. Every time you smoke, you can raise your blood pressure for a temporary period of time. And sleep well. Less than 7 hours of sleep and poor quality sleep are associated with high blood pressure. So overall, again, just to summarize, these are the life essential 8 that AHA recommends. Eating better, again, eating whole foods, fruits, vegetables, lean proteins. Being active, partaking in about 150 minutes of moderate activity or 75 minutes of vigorous activity per week. Or you can use a combination of them. Quitting smoking, this is the most preventable cause of death in the United States, and it can lead to many diseases, as we spoke about. Sleeping, it's very essential for cardiovascular health, and I would aim for about 7 to 9 hours per night. Weight, BMI goal is 18.5 to 25. Cholesterol, high levels of non-HDL cholesterol can lead to heart attack, stroke, etc. Sugar control, foods, and remember, foods turn into sugar that we use for energy, but sugar can lead to damage in many organs. And the A1C is a good way to assess your risk for diabetes, or if you have diabetes, a way to track it. And as well as blood pressure control, your blood pressure goal is less than 120/80, and over 130 and over 80 for the bottom number is considered hypertension. And that's about it. And this is my contact information. Please feel free to reach out to us.
Wow, that was great. That was great, Aditi. Thank you very much. And perfect timing on that, too. We're going to get to some questions. If you want to pull your slides down, I've been keeping an eye on the Q&A, and I will try to continue to keep an eye on it now, but it gets a little harder. But I've sort of grouped some of the questions into categories, and there, as you'd expect, there were a lot of questions about diet. People are very focused on what they're eating, which is great. One of the things you talked about, and I think this is something that gets people a little confused, is sodium in the diet. And if you could just comment a little bit upon how important sodium is as it relates to high blood pressure. But also, a lot of people think the only place they get sodium in their diet is the salt they add at the table. And it might be important to make people aware of where the majority of salt in the American diet comes from, what the majority of sodium in the American diet comes from.
Sure, I'd love to answer that. So I completely agree. I would recommend limiting your sodium intake. Your sodium intake does contribute to elevated blood pressures. And actually, the table salt is actually not as much of a contributing factor to your sodium intake as one would think. A lot of our sodium intake actually comes from frozen foods that we don't realize. It also comes from restaurant foods. A lot of the preservatives have a high sodium content in order to allow that food to be preserved. So those are the things I'd be much more conscientious about. A lot of the salt that we actually use and sprinkle on our foods at home or when we're cooking is actually very minimal in comparison to the amount of sodium that's in all the other foods that we don't realize. I'd
Right.
recommend
Yeah. I'm sorry. Go ahead.
No, it's okay. I was gonna say I'd recommend usually limiting your salt intake, especially if you have high blood pressure. Consider about 3 to 4 grams of salt intake or sodium intake per day, even less than that if feasible.
Yeah. The American diet is very high in sodium, much higher than anywhere else in the world. And I think the most important thing you said is read labels. People will be surprised when they start reading labels. Another part of diet that gets a little confusing to folks has to do with calcium and calcium-rich foods. And I think this is especially for women who are getting older, who are concerned about osteoporosis. Is the calcium that we eat in foods or even calcium supplements that people may be taking, is that the calcium that we see in the arteries that causes atherosclerosis?
No, not necessarily. A lot of the calcification in the arteries actually comes from plaque buildup. Over time, plaque becomes calcified, and this is actually what leads to hardening of the arteries and therefore, again, reduced blood flow, which can potentially precipitate heart attacks and strokes. So that's
Oh,
actually the plaque. That's the
yeah,
calcification in artery.
right, right. That's different kind of calcium.
Mhm.
A couple of other quick questions. Sometimes patients are told don't eat grapefruit. Why is that?
So it can sometimes affect, so they're metabolized by some of the by some of the other medications that we sometimes prescribe, such as statin medications. So we always recommend just being mindful of that. Some of these statins can interact. So always ask your doctor what medications you're on that could potentially interact with such fruits.
Yeah, you have to be careful. Okay, quick question. Eggs, good or bad?
Eggs, they're quite expensive these days too.
Yeah.
Eggs are actually, they're good in moderation. You can usually have one egg a day with yolk or two egg whites per day. If you have high cholesterol though, I'd be very mindful of this because it is a high source of cholesterol, so maybe limiting it to just a couple times a week if that is the case.
Yeah, there were so many questions. Someone was a little concerned that you mentioned bread as being bad, and I think it was just not that the bread's bad, but there was a lot of carbohydrates in bread, right? Was that the
Yeah,
issue?
yeah,
Okay,
that is.
yeah. And someone else asked a question saying there were some studies coming out of Europe that cheese can reduce the risk of heart disease. Are you familiar with that?
Actually was not familiar with that.
No.
I know, in general, I would recommend again against full 100% dairy products if you can go for the low fat things in general because that can contribute to again heart disease. But I was not familiar with that. I'm
Yeah.
sorry.
Let's go to the second most popular topic. It has to do with cholesterol. And so, um, if you switch to a heart healthy diet, first question is, how soon do you think you would see your cholesterol numbers get better? And
It
by
can
how much? How much would diet alone affect your lipids?
it can take a couple months and for some people even a longer period of time, but you can see small changes and over time they can continue to improve. Some people I've seen can actually reduce their cholesterol enough to a point where they don't require any medications. Sometimes it has a modest effect, but again, it can get you to your goals if you are quite aggressive. So that is something I would definitely recommend.
Now, here's the question. For someone who has vascular disease, who has coronary artery disease, carotid disease, peripheral arterial disease, is lowering their cholesterol with diet alone going to reduce their risk?
It can reduce your risk, and I think that it's an important component. But for patients who already have coronary disease, for patients who've had strokes and heart attacks, I would recommend being on additional medications. I do think that they are quite important in reducing your risk even further than just lifestyle changes.
Right. And of the components of lipids that you talked about, LDL, HDL, I don't know, ApoA, A, B, et cetera, which is the one that has sort of the most, let's say, predictive value for us when we're treating patients to know whether we're significantly reducing their risk? Which one of those numbers is most important?
I think the LDL is a great number. As you mentioned, there are a lot of different numbers that are used these days. For example, one of the more popular numbers is the apolipoprotein A, for example, and that is a good number to look at more of a genetic component of heart disease. That number is pretty static throughout someone's lifetime, but they're not medications out there that we found that reduce this number in terms of trying to classify what your risk is and tracking the number, I think LDL is a great number to go by. The lower the LDL, the lower your risk of heart disease and strokes.
Sure. Yeah, that's the number that we really tie a lot of decision making to. Someone asked about plant sterols. and that they're good. It's good to have that in your diet. Will that reduce your cholesterol, and is that sufficient to address elevated cholesterol, or can it actually increase your LDL? Do you know?
I don't think it can necessarily increase your
No.
LDL,
Right.
but it also does not affect your cholesterol very significantly, and it's not an alternative to lifestyle changes or statin medications. Again, there are many different types of medications out there, but statins being one of the main primary medications that a lot of the cardiologists and primary care physicians use.
So I'm going to maybe this isn't really the topic, but people ask this. If you can quickly just sort of, summarize who should be on a statin, who should have their cholesterol treated, what two groups of people need to be treated?
Sure. So people, like we mentioned, people who have coronary, meaning people who've had heart attacks, people who have evidence of plaque in their hearts, people who've had strokes, who have plaque builds up in their legs, for example, they qualify to be on a statin medication. People who have a history of diabetes, depending upon your age, they should be on the dose of statin medication will vary, but they should be on statins. And patients who have an LDL greater than 180, it's quite high. And at that point, regardless of any other factors, I would recommend you be on a statin. Thereafter, there are multiple other factors that can be taken into consideration to determine if you should be on it.
And you'll sometimes, when you go to your doctor, they may tell you they put your numbers into a risk calculator to see what your risk is, and we make some of the decisions based on that. Not all sugars are the same, right, Aditi? Not all sugars are the same. And again, reading labels, and people wonder about fructose. Is fructose a good sugar for us?
Fructose is not necessarily a great sugar for us. I would recommend again staying away from it. It's more the natural sugars that I like in fruits. Even then, patients with diabetes should be mindful of how much fruit they're having. But natural sugars are always better than the sugars that are in candies and in any added sugars that we have in our diet.
There's a question about lipids and perimenopausal changes. I'm going to defer that question and let people know that we have an entire session coming up on the perimenopausal cardiovascular issues that women need to be aware of. So I will give you the date of that later. Where was I? Okay, let's talk a little bit about blood pressure. Does blood pressure naturally go up as you get older?
It can. It's definitely more common and prevalent, as you can imagine, in the older population versus the younger population. It's because of the way the arteries are and the lack of elasticity and compliance as we grow older. So yes, it's more prevalent. Um,
And we talked, did we talk about the relationship between sodium and
yes,
blood pressure? We
yes,
did.
a
Okay.
little bit. Yes, yes.
I was probably trying to catch up on the Q and
Oh,
A.
no worries.
But in general, we've gotten a little bit more aggressive about wanting to treat blood pressure. And what would be, I know you told us what's, normal blood pressure, borderline to mildly elevated and elevated. Where are we? Where do we think we need to intervene with medication if lifestyle changes alone aren't helping?
So usually, again, as you kind of alluded to, as the data has been coming out, the lower they keep reducing the guideline for what's considered high blood pressure. And right now it's currently 130 over 80. If you have multiple readings of 130 over 80 or higher, at that point, I would recommend starting a blood pressure medication. So I also recommend patients monitor their blood pressures at home because they usually have a tendency to be higher in the office and bringing in your blood pressure
Right.
cuff to ensure accuracy.
Yeah.
But
Yeah, for sure. And does weight and blood pressure, do they have anything to do with each other? If you lose weight, will that help your blood pressure come down as well?
yes, it can definitely bring your blood pressure down. It doesn't have as great an effect sometimes as diet, but it definitely has an effect, weight and exercise.
Okay. Some questions under sort of the prevention umbrella. People want to know, like, at what age should I get a stress test? Should I be getting a carotid study to see if I have carotid buildup? Um, you know, who should be seeking advice from perhaps a cardiologist about prevention and testing to see if there's anything going on, even if they're not having symptoms? I know that's a tough question to answer, but I'll put it out there anyway.
Sure. It's a tough question, and I think it depends upon a lot of things. Depends upon your family history, your risk factors for things. It depends if, like you mentioned, if you're having symptoms of of heart disease, and these symptoms are not necessarily one size fits all. Many patients can have a variety of symptoms, so it depends upon all of the above to determine if and when you should undergo any type of testing, if it's even warranted at that time. Um,
For sure. So some folks were asking, about your recommendations about activity, 150 minutes a week, mild, moderate, or more strenuous exercise. Some folks said, I'm getting older and it's a little hard for me to get out. I can't do that much. What should they be doing, as opposed to nothing?
Sure. I'd recommend incorporating any type of activity in your day if you can, aka if the grocery store is 2 blocks away, try to walk to the grocery store. If you commute to work and it's a couple blocks, walk to work rather than drive to work. Even those small things really make such a big difference. If you have a dog, continue to walk your dog, maybe go on long walks. And I know it's a little bit more difficult in the cold weather as well. But as it warms up, try to make a conscious effort to do all of those things. At home, there are many different types of activities you can now do. They have all these videos online, all these free videos now for things like strength training and just doing these small workouts at home. Even 15 or 20 minutes makes a very big difference.
I'm going to ask you a follow-up question on the type of exercise. And you went through both cardio type exercise and isometric exercise. Do you think like real heavy straining isometrics is a good idea? Or are you talking more about sort of high reps, low weights, muscle tone versus holding your breath and having your veins stick out in your neck?
I think that I actually think that toning is great, especially for females. I think this is something that's actually very underplayed in terms of how important it is to our health. It is important that we maintain our strength, especially as we grow older, in order to prevent things such as falls, for example. Maintaining tone is very important. I would not recommend bulking up and really high intensity strength training unless that is something that you are being trained to do necessarily. Overall, if you are someone who's not a very competitive athlete, I'd recommend just regular toning in order to maintain good muscle strength.
There was a question about should diabetics be checking blood pressure? Should diabetics be doing everything they can to manage all of their other risk factors because they are at greater risk, right?
Yes,
Checking
100%.
blood.
All the above, really. Yes.
Right. How about supplements? That came up a bunch. Are supplements good, bad? Are they going to help me? Do they reduce the risk of heart disease? Some specific things that came up were fish oil, right? Over-the-counter fish oil, not prescription fish oil, or magnesium. Is magnesium good? You have any strong feelings about supplements?
So there's actually a study that came out about a year and a half ago now about supplements and actually showed that there was no cardiac benefit to using actually any supplements. When it comes to fish oil, we recommend prescription fish oil to bring down some of your triglyceride levels. But again, that the fish oil over the counter isn't necessarily strong enough and not recommended. And magnesium is not necessarily shown to mitigate any cardiac risk factors or cardiac diseases.
Yeah. A couple of questions on alcohol. We always get that. Is alcohol good, bad, or indifferent? Yeah, should it, what is alcohol in moderation? And can alcohol interact with any of the medicines I'm taking? Do I need to be concerned about that?
Sure. So, as I'm sure it's gotten a lot of publicity these days, alcohol has recently been shown, no amount has been shown to be good for you. From a physician perspective, I would recommend for females to have no more than 1 drink a day and for males to have no more than 2 drinks per day. So, females, 7 drinks per week, and males, 14 drinks per week as the maximum. In terms of medications, it depends what medications you are using. Alcohol does inhibit, it is metabolized by your liver. So certain medications that are metabolized by your liver should be taken into consideration. Other pain medications can affect your ability as well to think. And so I do think that this is something you should be asking your physician about depending upon what you are taking.
Yeah. This is a good question. At what age should we start monitoring cholesterol?
Mm.
And At what age should we even be thinking about starting to treat cholesterol? Because I think that's a moving target as well.
Sure, yeah. So they recommend actually screening even beginning when you're quite young, even in during puberty, at least once every 5 years or so, unless you're really high risk. Thereafter, I'd probably recommend getting screens on a regular basis after you're about 35 to 40 years old. And as to when you should start treating, again, it depends upon the things that I talked about earlier. Do you have a history of a heart attack? Do you have a history of diabetes, a high LDL? And then it depends upon your other risk factors. Usually 40 and above, that's when we start to think about we put your numbers into this calculator and look at your LDL, your HDL, your blood pressure, things along those lines that help us determine what your risk is. And then based upon that, we can provide a recommendation if you should be on a statin.
How about if I'm 80 years old and you put me in a risk calculator and it says, I'm at risk. Is there a benefit for, starting lipid lowering at a more advanced age, let's just say? What do you,
Sure.
and I know that's going to depend on a lot of other factors, and I don't want to give anyone advice, but in general, what you say?
I think like you're saying, it depends upon the other medical issues that somebody might have. If overall your life expectancy is more than a couple of years and you are functioning well and walking around and doing things, I say yes, that's completely fine. But if someone is quite sick and has a lot of other medical diseases, I'd probably say the benefit is not necessarily there.
I like this question. This is if I have coronary disease and I get put on a statin and I get my LDL really low, okay, and we define that usually as under 70, let's say, right? Is there a chance that some of that plaque in my arteries can actually, dissolve or regress? Has that ever been shown?
Some studies do show that. Again, it's very limited data, but yes, some studies do show it, at least it prevents progression, and some studies show it can cause some regression. Yes, that's a great
And,
question.
and how about if I've been on a blood pressure medicine or I've been on a cholesterol lowering medicine for a long time and I'm getting older, did they stop working as well? Do I develop tolerance to those things or do they continue to help me?
No, you should not. You should not necessarily develop tolerance to these medications. If anything, I would hope over time, as we reduce your risk factors, we can come off of these medications. But hopefully, I'm hoping that most of my patients stay on the same regimen that they are on.
And is there a way, I got my cholesterol level and my LDL is not bad, but my HDL is really low. What can I do to raise my HDL?
Sure, certain foods and actually exercise can bring up your HDL quite a bit, but there are also certain foods that can definitely bring up your HDL.
Yeah. There's a question here that I think I'm going to defer it, although I don't think we do have a webinar coming up on this. It has to do with someone who's had chemotherapy. And, is there a risk that chemotherapy can affect the heart or, other therapies for cancers? And, is that something I should be paying attention to?
Yeah, this is a great question. I actually do a lot of cardio-oncology research, and yes, chemotherapy can affect the heart. It depends what type of chemotherapy you are getting. Anthracycline therapy, for example, is known to be one of the biggest risk factors for cardiac disease, and that just means that we have to continue to monitor you on a regular basis, and not just when you're getting the chemotherapy, but actually for many years thereafter, you can still develop cardiac effects. So in general, again, this is a hard question to answer because there's a lot I can talk about for it, but yes, it can lead to heart disease and you should be monitored.
And we do have a subspecialty program in cardio-oncology, and we have cardiologists who specialize, like Dr. Bhagat, in cardio-oncology, and we certainly encourage patients to be seen in these clinics because there are many issues that need to be addressed for them. Um, where was this? Oh, I just lost it. Oh, so what's a normal heart rate? What's a normal resting heart rate?
So 60 to about 100 or so, be normal.
Okay. And so if my heart rate is accelerated all the time,
Mhm.
is that something I should be paying attention to? Or if I find that when I go out and I walk, my heart rate goes up really high and then it takes a really long time for it to come back down. Is that something I should look into?
Sure. It depends. So, to your first question, it depends if your heart rate is consistently 110, 120, 130, you should get that checked out by a cardiologist. It can be due to a variety of arrhythmias, and it's hard for me to tell you definitively what it is without seeing you and giving you a monitor and looking at your heart rhythm. If it goes up when you exercise and then comes back down, that is a normal physiological response, such as when you're walking, exercising, running, stressed out, etc. Your blood pressure and your heart rate should both increase in order to compensate for the level of activity that you're doing. Your heart rate should be coming down in a timely fashion. It does take a little bit of time, but it should be coming down hopefully to your baseline within probably 10, 15 minutes or so.
Yeah, I was going to type an answer to this one, but I said no. I'm gonna put it out there. Here's the question: is intercourse dangerous for a man above the age of 70?
Nope, not necessarily. I would say you can partake in it as long as, again, you are aware of what your health diseases are, and you talk to your physician, and you're able to. This is still vigorous activity, and we like to ensure that your heart is able to tolerate this activity. But I would let your physician know.
Excellent. We did isometrics. Oh, smoking. Is there any good reason to smoke? No. All right. Someone asked, is vaping good, bad, or indifferent? Is vaping something that can affect your health?
Vaping can definitely affect your health, and again, I don't think there are not that many long-term studies out there because it is such a new thing. However, the data currently, the short-term data does show that it is not good for your health in general. Just because it's not tobacco doesn't mean it does not have harmful effects, and it can definitely lead to a lot of lung issues.
Yep. So I'm going to apologize. We had a lot of people here tonight, and there are a lot of questions, and I couldn't get to all of them, but I tried to kind of highlight the major topics, but we're just about out of time. And so I want to thank Dr. Bhagat so much for a spectacular presentation and magnificent slides.